Good morning, everyone. And it's very, very beautiful and happy day because we are starting with 142 participants. And I can see the power of, today's speaker. And today's topic is infection prevention and control. And may I request all the participants to keep their video and audio off, please. Please do not, because we are being live too. So please do not start your video. So I'm very happy to introduce Ms.Bijaya Thongam from Preventi. And we can see, may I really request everyone to put off the video, please? Don't start your video. Please put your video off. You don't need to be on video to see your ma'am. So please stop video. And also audio. If you do not listen to me, I'll be forced to take you out from here. So please don't do that. So the facilitator today is Ms.Bijaya Thongam. She is one of our Annie's Patient Safety Fellows of 2021. And a very quick word, Patient Safety Fellows is that this is a fellowship that we have started with in association with Patient Safety Movement Foundation. This was initiated last year. And we are very happy that last year we had 7 of them, and this year we have 8 of them. And all of them are very active in contributing to patient safety and by giving tools and resources to nurses and to nursing students. So the last year's Patient Safety Fellows have committed themselves to create learning solutions for nurses and, nursing students on WHO patient safety curriculum. And we have been dealing with that from January 2021. And we are already in the month of, this is the session for September. So today, Bijaya will be discussing about infection prevention and control. So a very quick shout out to everyone to inform that our Patient Safety Fellows have created a very useful guide for nurses, which is called Essential Meds Made Easy. There are 100 medications which have been showcased, one drug, one page. So very easy. Just the basic information has been, included there. And so how can you get access to it? Just visit our website, www.annie.in. Then click on the Knowledge Center. And in the Knowledge Center, when you click on Knowledge Center, you will find publications. So you can go to publications, and there in the publications, you will find Essential Meds Made Easy. The PDF is there. So a basic, form needs to be filled so that we know that who is downloading it. It's totally free, so you can download the entire PDF. We really hope this will become very handy for all nurses and our nursing students to make medication safety, easy. And it is very important that one of the major work that we nurses do is give medications to our patients. Now, coming back to today's topic. So before that, before I call upon, Bijaya, I just wanted to say a few things, and let's move on and stop sharing in a minute. And all those who are interested to become our members, please visit our website and you can become our member to contribute to nursing and also to learn from other senior members in the organization. And next, end of this month, we will be dealing with another topic, patient safety and invasive. As I told you earlier, in case you have missed the previous sessions, you can go to our website and you will find. I would really request everyone to be disciplined. It is lovely to have so many of you here, but please stay disciplined. Keep your audio, video, please muted so that there is no disturbance during the discussion. So coming back to, if you want to learn more about all the Empower Hours, all the topics that was discussed from WHO Patient Safety Curriculum, feel free to visit our YouTube channel and you will find all the recordings there. And you can run the recordings as a class for your group of nurses and nursing students, because you can't get guest lectures, but you can get it very freely from our YouTube channel. There are so many of Empower sessions, plus there are very useful and practical webinars which are available from the time that we have started, doing online webinars. So we really hope that all of you will be, benefiting, and you should go and look out into the YouTube channel and use that. You can just play it. I mean, you can play it from the YouTube, and you just need Wi-Fi, and you get people to sit there and take attendance. So it kind of, addresses many requirements. So you can use it as an ongoing education for your, nurses, and also you can use this as additional learning for your nursing students. So with that, thank you so much for joining us here. I am Thongam Gomez, the founder president of Association of Nurse Executives India, and I'm also the mentor for the ANI Patient Safety Fellows. And I'm very honored to present Ms.Bijaya Thongam today to take us through the topic of infection prevention and control. And I was trying to see, is there any data around, infection prevention and control in India? So what I did is I put that query into my, Google. So what does the Google say? That in 23rd November 2021, it reported that a study at a tertiary care center in India had 15% invasive fungal infections in the ICUs. So across the world, they say, 1 in 10 patients can get hospital-acquired infections when they are in the hospital. And interestingly, I just found another site which also talks about healthcare-associated infections surveillance in India. I mean, that is something new that I have seen, and this is from All India Institute of Medical Sciences collaborating with the Center for Disease Control and Prevention and the Indian Council of Medical Research. So something has started working, and this is from the government. I'm not very sure how many of the private organizations are here. I'm not very sure, but we all must know that, having data is where we can start to address the problem that we have. So it's very important to remember that, we have to report if there are any malpractices around infection prevention. In case you don't get resources, you should speak up. That is the responsibility of the frontline workers to speak up, that in case you don't get the resources on time. And infection prevention is probably one of the most basic rights of any patient. So when they come in with whatever is their disease or their infection. We should not give them another infection. And the cornerstone of infection prevention is hand hygiene, which we all take for granted. So I really hope that all of us will reflect while Bijaya is taking us through the session. So a very warm welcome, Bijaya, and it is 11:10. So you have an hour, or maybe you can take 10 minutes extra. So may I request you to come on the video, Bijaya? Hello, Bijaya? Hello? Bijaya, are you there? Hello? Bijaya, can you come on the video, please? I can see you there, but you are not starting your video or audio. Hello? Hello, Bijaya? Bijaya, could you please come on the screen, please? Hello? Bijaya, can you please come on the Video, it is time for you to start the session. It's 11:10. Thank you so much, Vijaya. Can we test your audio, please? Can you start on the slideshow?
I have started.
No, go back to the first screen.
Yes, ma'am.
So all the best, Vijaya. I am right here. I will stay off the video and off the audio. Okay. All the best, and request all the participants to keep your audio video muted so Vijaya can take us through the topic in the given time. See, it's 11:10. Vijaya, you have 1 hour, 60 minutes. Okay. Thank you. All the best.
Thank you, ma'am, once again. A very good morning to everyone present. I, Ms.Bijaya Thongam, A&E Patient Fellow 2021, is here to discuss on the topic, which is very common, but yet very critical aspect of the patient care. That is the infection prevention and control. It is very important because if you do not prevent and control infection, we will be giving harm to the patient, like how we harm with medication area, and any is committed to zero harm. This content is based on the WHO patient safety curriculum. So let's go in detail. So the objective of this topic is to identify the extent of the problem, to identify and analyze the models of infection, that is the transmission in healthcare setting, and to integrate the main principles and methods of healthcare associated infection prevention and control. So let's see the introduction. Now, as we know that infectious diseases are dynamic in nature and keep emerging and re-emerging from time to time. But due to the serious illness like HIV, hepatitis B, hepatitis C, and D, the focus of infection control has changed. In the past, the infection control was mainly focused on protecting the patient, especially during the surgery. But now it is equally important to protect the healthcare providers and the others in the community. So before we go in detail, let's see a case scenario which was there in one of the hospitals. So there was a patient by name Sam who was 42 years old. He came for an endoscopy at a local hospital. And prior to the surgery, prior to the procedure, he was injected with sedatives. However, after several minutes, the nurse noticed that Sam was feeling uncomfortable and required additional sedation. So she used the same syringe which was dipped in the open sedative vial and re-injected him. The procedure continued as normal, but several months later, Sam started suffering from the swelling of the liver, the stomach. Then he also had pain, fatigue, and jaundice, and later he was diagnosed with hepatitis. So they contacted the Disease Control Center for Disease Control and Prevention, that is CDC. And then it was found that there were 84 more cases of liver disease which was linked to the same clinic. So it was believed that the sedative vial may have been contaminated from the backflow into the syringe, and that the virus may have been passed on from the contaminated vial. So imagine the situation. It was totally preventable, but due to the malpractice of the nurses, the patient had to suffer. So this is an example of healthcare associated infection. So let's see what is healthcare associated infection. According to WHO or World Health Organization, they define healthcare associated infection as an infection acquired in the hospital by a patient who was admitted for a reason other than the infection or an infection occurring in a patient in a hospital or other healthcare facilities in whom the infection was not present or incubating at the time of the admission. So let's see the burden. When a patient has healthcare associated infection, it increases the patient's suffering. It also prolongs the length of the hospital stay. It also causes permanent disability. It also increases the mortality. And then it also becomes resistance to conventional treatment. It also increases the cost to the patient as well as to the hospital. Finally, it leads to demoralizing the patient as well as the staff. Now let's see the causes, the mode of transmission of healthcare associated infection. So when you see the sources of healthcare associated infection can be from the human sources or it can be from the environmental sources. So when we tell about human sources, it is nothing but those infectious agents which are from the patient, which are from the healthcare workers or from the visitors. Whereas the environmental sources can include can be from the food, can be from the water, or can be from the medication, or can be from the IV fluids, etc. And this healthcare associated infection is caused by the virus, the bacteria, and the fungi. Now let's see the mode of transmission. Now there are basically 5 modes of transmission. The first one is transmission through the contact, indirect transmission, airborne transmission, percutaneous transmission, and then you have the last one as a droplet transmission. So let's see one by one. So when the first one is the transmission through direct contact. So when from the word direct contact, it means that the transmission occurs from patient to patient, especially when the microbes present in the blood or other bodily fluids of a patient enter a healthcare worker or a vice versa through the contact with a mucous membrane or a breaks, or for example, a cuts or an abrasion in the skin. So for example, if you have got a cut in your any part of your body, especially your hands, and when you go to the patient care, and there may be high chances of getting transmission because of the cut. So that is an example of direct contact. Now, second is the indirect transmission. Here, the infections are transmitted indirectly through the devices such as the thermometers. It can be equipments which are unsterile. It can be medical devices or toys where the health worker pass from one patient to another. And this is probably the most common mode of transmission in the healthcare setting. For example, you have used a thermometer for Mr. B in patient 1, in bed number 1. Now, without proper disinfecting, you went to take the temperature in bed number 2 for Mr. B. Then there is a chance of getting transmission because you have not cleaned or you have not cleaned the thermometer properly, or you have not disinfected the thermometer properly. So this is an example of indirect transmission. Now coming to the droplet infection, as we know, the droplet infections are caused by the respiratory droplets, where the infectious pathogens are generated when an infected patient or a person cough, sneeze, or talks, as well as during procedures such as the suctioning and endotracheal intubation. And the fourth one is the airborne transmission. Here, the airborne transmission of infectious disease occurs through the dissemination of either the airborne droplets, nuclei, or the small particles in the respirable sites. For example, the spores of Mycobacterium tuberculosis may be dispersed over the long distance by the air currents and may be inhaled by the individuals who do not have direct contact with the source. And the last mode of transmission is the percutaneous exposure. So when you tell about the percutaneous exposure, it is basically nothing but it is the transmission of infectious disease through the contaminated shafts. So for example, you have used an surgical blade for Mr. B, and then the same patient had got hepatitis B. But unfortunately, without knowing, you have used the same scalpel blade for another patient. Then it is known as a percutaneous exposure. So now let's see the types. Of healthcare associated infection, which accounts for 80% of all the infection. So the first one is urinary tract infection, usually associated with catheters, or we also call it as the COTI. Then we have the second one, that is a surgical site infection. Then the third is bloodstream infection associated with the use of the intravenous device or the CLEPSY. And then the last one is the pneumonia associated with ventilators, also called as the VAP or ventilator associated pneumonia. And out of this, we should remember that urinary tract infection associated, catheter associated urinary tract infection or COTI is the most frequent, accounting for about 36% of all the healthcare associated infection. Now, let's see the different modes of health prevention and control. So the first one is the hand hygiene. So everyone who is working in the healthcare, whether it's in the hospital, the clinic, or the patient, or at the patient's home, needs to be aware of the hand hygiene. And hand hygiene is the single most important intervention that every healthcare worker can practice to prevent the healthcare associated infection. So I repeat again, health hygiene is the single most important intervention that every healthcare worker can practice to prevent the healthcare associated infection. And so let's see the purpose of hand hygiene. The purpose of hand hygiene is to prevent colonization and infection of patients and healthcare workers, as well as the contamination of the environment. Therefore, an indication for hand hygiene will arise whenever there is a possibility of microorganism transfer from one skin or inanimate surface to another surface. So let's see the moments of hygiene. So basically the moments of hygiene, there are 5 moments. You have to remember that you should wash your hands before touching a patient. Secondly, you should wash your hands, or you have to have hand hygiene practice before a clean or an aseptic technique. Thirdly, after bodily fluid exposure risk. Fourthly, after touching a patient. And at the last, you should also wash your hands after touching the patient's surrounding. So now let's see the steps of hand washing according to the WHO. So before you do the hand washing, you have to remember that you have to remove all the wrist as well as the hand jewelry. It can be your watch, it can be your bangles, it can be your finger rings. At the same time, you also should cover if there is any cut or any abrasion with the waterproof dressing. And your fingernails should also be kept short, and false nails should also not be worn. So let's see the WHO hand washing technique.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
So we have seen the hand washing technique according to WHO. So here, the duration of the entire procedure is 40 to 60 seconds. But you have to remember that in order to make it efficient, you should wash at least for 60 seconds. Please do not do it till 40 to 60. Remember, at least 60 seconds you have to follow it. And so regarding the hand rub also, if you are using the hand rub, you have to make sure that you have to do it at least for 30 seconds. Now let's see the other PPE. So we know that the PPE includes, or the personal protective equipment includes your gowns, your gloves, aprons, eye protection, the shoe covers, and the face mask. But this use of PPE is basically based on the assessment of the risk of the transmission of a microorganism from a patient to a caregiver and vice versa. That means when you wanted to use a PPE, you have to assess first the risk of the transmission. And now here, what we are going to see today is the WHO guidelines for the use of the sterile gloves. Now, if you see in the hospital or in the clinical practice, gloves are an everyday part of it. And it is also one of the important components of the set of the standard precaution. And there are 3 types of gloves which we have seen. That is the surgical gloves, the single-use examination gloves, and the last one is the heavy-duty household gloves. And then when you see about the indications of the wearing gloves, you have to see the first indication is to protect the hands from contamination with the organic matter and organism. And the second one is you have to use the gloves to reduce the risk of transmitting infectious microorganisms to patient, to the staff, as well as to the others. And you also should remember that wearing gloves does not replace the need for hand hygiene. I repeat again, you should also remember that wearing gloves does not replace the need for hand hygiene. Gloves are also not free from defect and sometimes they leak. So there are studies which shows that even when the gloves are worn, hand may become contaminated. So if a glove tears or damaged or it gets leaks, you should always remember that you should remove the gloves, perform hand hygiene, then put on to the new gloves. So let's see the use of sterile gloves. What are the guidelines which are given by the WHO? So the sterile gloves are indicated when you do any surgical procedure or during the vaginal delivery, or it can be during the invasive radiological procedure, vascular access and procedure, example, the central line, or it can be during the preparation of the total parenteral nutrition and chemotherapy drugs or agents. Now, the next one is the guidelines for the use of clean gloves. Sometimes we do get confusion whether we need to use the clean gloves or we need to use the surgical gloves. So let's see what is the guidelines according to the WHO. So your clean gloves are indicated in 2 areas. That is in direct patient exposure and indirect patient exposure. But both of you should make sure that the clean gloves is used when there is a potential for touching the blood, bodily fluids, secretions, excretions, and items visually soiled by bodily fluid. So in direct patient exposure, you will wear your clean gloves when you have a potential with contact with the blood, contact with the mucous membrane and non-intact skin, or it can be the potential presence of highly infectious and dangerous organism, or it can be during an epidemic or an emergency, or during IV insertion, during drawing of the blood, or it can be during the suctioning through the non-closed system of endotracheal tubes. Whereas you have the indirect patient exposure, where basically you will wear the clean gloves when you wanted to empty a kidney tray or a basin where the patient had vomited or the vomitus is present, or when you wanted to handle the instruments, or when you wanted to clean the instruments, or when you are handling the waste, or when there is a spillage, when you wanted to clean up the spilling of the body fluids. So let's see when are the gloves not indicated, or when should you not wear the gloves. So here also we have two, that is the direct patient exposure as well as the indirect patient exposure. So you should remember that your gloves are not indicated when you are going to check blood pressure, when you are going to check temperature, when you are going to check pulse. Or when you wanted to perform the subcutaneous and intramuscular injections, or it can be during bed when giving bath, dressing a patient, or when you are transferring or transporting a patient, when you wanted to care for the eyes or ears where there are no secretions. And indirect patient exposure, your gloves are not indicated while picking up the telephone, while giving oral medication, or while doing charting or documentation on the patient chart, or it can be removing and replacing the patient linen bed, etc. Ma'am, you can hear me?
Yes, we can hear you. We can hear you.
Okay, ma'am. Now let's see the other guidelines for the other PPE. So the first one is the apron. So wear a disposable plastic apron when in close contact with the patient or the material or an equipment, or when there is a risk that the clothing may become contaminated. And you also should have to dispose the plastic aprons after each episode of care or procedure. For example, you had been using a plastic apron for carrying a patient in bed number A for bed number 1 for Mr. A. So before you go and do or give the care to Mr. B in bed number 2, remember that you have to remove your plastic apron as well. If you are using the gloves also, you have to discard, and then only you have to wear a new one in order to care for the next patient. Third one is wear full body fluid repellent gowns. So sometimes you need to wear the full body fluid repellent gowns when there is a risk of extensive splashing of the blood. It can be the bodily fluids, secretions or excretions. Example, in the OT, in the trauma ward, or it can be during the labor room during the delivery. Here, even if you have to wear the shoes also. Then your face mask and eye protection should be worn when there is a risk of blood, bodily fluids, secretions, and or excretions splashing into the eyes and the face. Now let's see the other measures for the prevention and control of healthcare associated infection. So the next one is going to be the safe use and disposal of sharps. Here, you should remember that you should not throw the loose sharps in the trash. Do not put the sharps in the recycling bins. Do not flush the sharps down the toilet. And also, you should keep out of the reach of the children. Then do not force the sharps into the container if it is full. Do not put your fingers inside the container. Do not remove the needle. Do not bend or break the needle. And do not recap the needle. And at the same time, do remember that you should have a puncture-proof or a sharp container whenever, while throw in the puncture-proof container. Now the others. So in others, it includes the use of effective sterilization procedures. Now we used to send the articles or the equipments for sterilization. But what do we see? What do we have to monitor? We should monitor the efficacy of the disinfectants, whether the sterilization method is maintained properly or not, or whether the use of disinfectant is used properly for that particular instrument or for that particular articles. Then the next one is prophylactic antibiotics. Sometimes prophylactic antibiotics are given before the surgical procedure or any dental procedure, but this will depend on the protocols of the hospital. Then the next one is be immunized against hepatitis B. So if you have to go in the clinical areas when you are a student, please make sure that you get fully immunized with hepatitis B before you go to the clinical areas. And then the last one was, excuse me, practice standard precaution. So practice standard precaution. So the standard precaution is applicable to everywhere, irrespective of the, is applicable everywhere. And it should also include the hand hygiene. Now, excuse me, a point to remember, if you have to have a hand hygiene, you need to report and seek treatment for any skill condition, particularly those affecting the hand. And hand hygiene, either hand washing or the use of alcohol-based rub, cannot be undertaken if the skin condition like dermatitis or eczema are present, because if you have infection, it will place the health worker as well as the patients at the risk of infection. So, so let's protect the patient, their families, our families, and everyone by implementing with what we have learned today. So let's try to have the zero harm for our patient. And thank you everyone for your active listening.
Thank you, Bijaya. That was a pretty long topic, but very well summarized into just about 30 minutes. That's an art, I should say. But yes, there is so much more in each of the line that Madam Bijaya has discussed. Each topic would have further deep dive for every single nurse that is required to be done. A few things that I would like to emphasize is that you must educate yourself more into the practical aspect of implementing. Vijay has quickly covered all the things that is covered in the WHO so that, it becomes a very quick refresher for all of us. But when you do your infection control, learning, what you should learn is, of course, a little bit deep dive into all the topics that Vijay just mentioned, starting with transmission sources and, how do you break the chain of infection? How do you, what is the impact of hand hygiene? And why did she say that, you should always train for 60 seconds and 30 seconds? Because we have seen it in hospitals that, when you train someone for 40 seconds, then the time they usually use is always less than 40 seconds. So it does not come into the window. So it is better to give the maximum time so that, you will always remain within that stipulated time, the recommendation. So we talk about, 60 seconds for hand washing, 30 seconds for hand rub. One very important thing to remember is that hand rub can only be used on clean hands. That means there is no visible contaminant on the hand. So you cannot use hand rub for everything. And there is definitely one condition in which you must only use hand wash. You cannot use hand rub. That's a quiz to all the students sitting here. Can someone put in the chat box an answer? In what condition you cannot use hand rub at all? You have to wash your hands. Anyone in the chat box, please? Let's see that how many of you know this? No need to unmute, just put it in the chat box, please. Put in the chat box. Type it into the chat box, the answer. We have 125 people here, so at least one person should be knowing the answer, I guess. Okay. Time is running. Anyone? Please type into the chat box. Seems like a challenge. Nobody wants to type. When soiled, not, no. My question is, there is a condition, a disease condition, an infection where even if your hand is clean, you cannot use hand rub. For every exposure, every hand hygiene opportunity, you have to do hand wash only. You cannot use hand rub. What is that condition? Okay. GDH. What is that GDH? I am not very sure what is GDH full form. So if you put a full form, will be good. Okay, without wasting time, I'm going to give you the answer. Please learn that for today. Clostridium difficile infections. It's a GI infection which is now increasing in India. That happened. It is also a hospital-acquired infection that happens because of too much use of antibiotics. So this is called Clostridium difficile. So patient has got, diarrhea. So in that case, you cannot have hand rub. Like I'm going to take the, change the linen of the patient. It's a clean procedure. After that, in other patients, you can use hand rub. But in Clostridium difficile infection patient, you have to wash your hands. That's the difference. So you only hand washing can kill that organism. So you cannot use hand rub in that case. That's something you need to keep in mind. Another tip that I would give to all of you is that always remember, just before wearing gloves, just after removing gloves, always use hand hygiene. It is mandatory. You cannot say that, I washed my hand maybe when I came for duty, I didn't do anything much and now I'm going to wear the gloves. It doesn't matter what gloves you're wearing. It's a very basic mantra that all of you can take with you for life. You don't need to think about it at all. So there is no way. If you see someone removing the gloves and trying to pick up the phone, that means there's something wrong. They should not do that. There's no way. So soon after removing the gloves, I should be using, hand hygiene. Nowadays, you get non-powdered gloves. So in that case, you can use your hand rub. Hand washing, all of us know. So there was a study that was done on observing people in the airport. How many of the people who visit the toilet, they wash hands? Minimal. It's a very interesting study. Everybody goes to toilet. All of us know that we all should wash hands after going to the toilet. So they found that, I think the figure, if I remember correctly, is about 16%. That's it. The rest were all coming out just like that. So maybe next time when you're in the airport, maybe you'll spend a few minutes watching that how many people are actually washing hands. So you can imagine how contaminated those taps will be. How contaminated when we touch those taps. We kind of open the tap and then we put our hand just under the water. That's another finding. People not using soap, just putting hand under the water and thinking some magic will happen through the water. It cannot happen. So we have to have, there are 3 components of hand hygiene. I just want to tell is that one, most important, duration. How long are you rubbing your hands or washing your hands? So just now you already learned 60 seconds, 30 seconds duration. The second one is your amount. What's the amount of soap? So like in WHO, they said, take adequate amount of soap and also adequate amount of hand rub. So let me give you some tips on hand rub. Many of us know that you would have been trained in various different ways that how much hand rub to take. So let me just give you a very practical tip today. All of us have different hand size. Some of us have small hand, some of us have large hand. So the volume that is required will also differ because our surface area changes with the size of the hand, right? So what you should know is that always make a nice cup out of your hand, cup, that there is a cup that you can make and take hand rub that will fill that cup. That should be enough for you to cover all your surfaces when you're doing that. Rubbing the hand which is already dry is not going to help, right? So you should have enough of your hand rub solution. So how do you take? You make a nice cup and take enough in your hand and then you know your duration. So very easy tip to remember is each action 5 times. Each action 5 times. So you will reach 30 seconds. So if you do that, so many times you would see in hospitals, whether it is doctors or nurses, when they are taking the hand rub, they kind of take the hand rub and say, hello, madam, how are you? How was your night yesterday? Did you sleep well? And then finished. Then they touch the patient. So I'm taking this opportunity to talk to many, many students who are here, that these are basic knowledge that we take when we become nurses, and it should stay with us as long as we are handling patients. Even at home also, this information is going to come handy. So we said the first one, duration. Second one is the amount. The last but not the least is very important, is the friction. Is the friction. Friction means, now all of you who are here, maybe you can do a little exercise. I don't want you to come to the camera. Let's do a namaste activity. All of us, let's fold our hands as namaste. Okay, now feel inside. What are the surface areas which are not touching each other? You can feel it. Those are the areas which are always missed in hand wash and hand hygiene. So what you need is, you need friction. So when I do this activity, I have to be aware that I need to have both surfaces touching each other. If they are not touching each other, there's this famous Taylor study, which is still used in many infection prevention classes. The most common areas which are missed during hand hygiene. So you will see that this area is most commonly missed. The tips are most commonly missed. The interlacing, these are commonly missed. This area is, the thumb is missed. So when we do those steps, it's very important to remember, when I'm doing this, what am I missing? And when I'm doing this, what am I missing? When I'm doing this, what am I missing? When I'm doing this, what am I missing? So these steps which is given by WHO is actually to ensure that we are able to touch all surfaces of our hand, so that our hand becomes safe to touch the patient, or the hand becomes safe to take care for ourselves. The hand becomes safe for our family. So please remember that when we look after our patients safely, we are also ensuring that we are safe ourselves and we don't pick up any infection from the patient. And we are also taking that safety back home, that we are not taking any organism from hospital to home. Another practical, see, I have been in hospital for many, many years. That's why I'm trying to, share those problems that I have faced when I was in hospital. Many times, Vijaya very clearly told that when you're doing hand hygiene, make sure that there is no jewelry, there are no long nails, no artificial nails. These are not to stay inside the book. This is something that we need to practice. So when we are looking after patients, we need to make sure that our nails are cut short. There is no nail polish, no chipped nail polish, and no jewelry. So many times, people will argue, ma'am, but I will wear the wedding ring. No, yeah, wear the wedding ring, but you must know, under the wedding ring, you cannot wash. So are you taking risk for yourself and your family also, if not for the patient? So it is very important that you remove all the jewelry, including your watch. Imagine you pay attention to your own hand. If you are wearing watch anywhere and when you start washing, you'll always make sure the watch is not getting wet. So what happens? You don't wash this area. So when you don't wash that area, obviously microorganisms are going to stay there. We cannot see the millions of microorganisms which is there anyway on our skin. And on top of that, we go and touch the patient, we do procedures, so then we can very easily take it to another patient. So hand hygiene is the cornerstone of infection prevention in any hospital. Now, very important to remember, the word is always infection prevention and control, not just control. Control gives the story that, let the infection be there, we will control it. No, the first step is to prevent infection. And to prevent infection, hand hygiene is the most powerful tool that any one of us can have. So these are some of the tips I just wanted to give to you because, yeah, another problem that I faced when I was in North India was to do with threads. We tend to hide behind our rituals. Some people will say, oh, I just had married, so I have to put all this kada here. So I asked them that, does that mean that this kada will become a vehicle for transmitting infections between patients, and you will also take it to home? Do we want to do that? When you tie a lot of threads, you cannot wash them clean. Please understand that. I wish, somebody will do a study to see that how much of microorganism is there in the threads and in the kadas. We feel that, I can wear one bangle. I have seen this many times. People think they can wear. So I would always say, because if you are handling patients directly, you will forget to remove it when you're washing hands. And you are going to contaminate those bangles or threads or whatever that you're wearing, you're going to contaminate. And you will take that home also. Not for the patient, care for yourself and for your patients. So thank you so much, everyone, for being here. I hope today you have taken some pearls of wisdom from here. And also, please look out for our mega quiz that is going to happen in December based on all the Empower Hour that we are doing till November. So you should be able to go back and look at those videos, and then we will come up with a mega quiz, Association of Nurse Executives India, which will be open for all nurses and nursing students. So I really hope that you'll go and watch those videos, prepare yourself, learn, and then put it into practice. So thank you so much, Bijaya. Thank you so much for being here. And let me stop the recording now. Many times I tell myself that, I will stop the recording for now. I'll just run our advertisement once again for Annie. And then I am going to, leave the people to ask any questions if you want, so which you can do. So that was today, Vijaya discussing the infection prevention and control. And I have already mentioned, please take advantage of this document prepared by Annie Patient Safety Fellows, Essential Meds Made Easy. Just visit our website, then click on Knowledge Center. And in the under the Knowledge Center, you will find publications by Annie. Click on that. It will take you to this segment where you need to fill few information and you can download the PDF very easily. So once again, a shout out to all the nurses who would like to contribute back to your profession. Please join us and make us stronger by our collective voice. And we look forward to seeing you on 29th of October when Ms. Shani Verghese will be discussing about patient safety and invasive procedures. So thank you everyone for being with us, and I am going to stop the recording for now.